Hi, everyone. Hi, friends. Thank you so much for joining us for the Hows and Whys of Acupuncture and Fertility Enhancement presented by licensed acupuncturist Rachel Weiss. If you want to learn how acupuncture and herbs can enhance fertility, improve IVF success, and overall health, then this is for you. So my name is Lynn Poland. I'm the co-founder of Kindred Beginnings, a family building support community offering a safe, brave space for those navigating the journey to be support, heard, and validated. If you have any questions about our programs or how we can help better support you, please reach out to me or visit our website. So we've got a long bio here for you, Rachel. So let me officially introduce Rachel Weiss. Rachel is a licensed acupuncturist in Pennsylvania and New Jersey and board certified by the National Certification Commission for Acupuncture and Oriental Medicine. In 2008, she earned a Master's of Science in Acupuncture with honors from Tri-State College of Acupuncture. At Tri-State, Rachel was trained by masters in 3 distinct methods of acupuncture: traditional Chinese medicine, Japanese acupuncture, and acupuncture physical medicine. In 2020, she completed a certificate in Chinese medicine degree at the Wan Institute of Graduate Studies. In 2015, she earned her Reiki 2 training certificate from the Reiki School of Philadelphia. Rachel draws upon her eclectic training to design a course of treatment perfectly suited for each individual patient's needs. Rachel also earned her certificate of training from Beijing University of Chinese Medicine in Beijing, China, where she gained clinical experience at the Haiping Li Hospital, Maitan General, and other hospitals in Beijing. Rachel is a registered nurse with over 20 years experience working with patients throughout the life cycle, from labor and delivery and high-risk perinatal nursing to working with hospice patients and their families. She practices Zen meditation and incorporates Zen principles of mindfulness into her acupuncture practice. And you can learn more about Rachel and all of her fabulous services and all of her work at healingspaceacupuncture.com, and we will link that to this video. Rachel has also been a proud supporter of our Walk of Hope New Jersey since the beginning, and thank you so much for continuing to support our community. So welcome, Rachel. Thanks for being here.
My pleasure. It's such a needed service. Such a needed service. I'm glad you guys are all supporting each other. It's very important.
It is. And in full disclosure to anyone, so Rachel was one of my acupuncturists when I was on my family building journey, and I just feel the need to disclose that. So I've known Rachel for quite some time, and she's fantastic. And we were talking before we recorded about just some of the things that we should be looking for in an acupuncturist. And so, Rachel, if you wouldn't mind just kind of speaking to that.
Sure. Yeah, I would interview your acupuncturist and make sure that it's a good fit, because you want to be able to look forward to your treatments. You want to feel comfortable, welcomed. You want to feel calm. You want to make sure that your acupuncturist works with a lot of fertility patients and knows the cycle and knows women and knows what, women who are going through ART and what they're going through. So I think that's really important.
Is when you're dealing with somebody that's going through fertility treatments, is there like a different process or practice that you use?
Well, what you want to do is you want to be able to treat your patient where they are in their cycle, as well as treat whatever diagnosis they've been given. So you want a practitioner who knows the menstrual cycle essentially, and knows, is very familiar with problems with fertility. So you want an experienced practitioner. It's important. And I felt lucky because I was, a nurse in obstetrics. And so I was familiar in that way. That's why I felt comfortable from the beginning working with women for fertility, although they're very different. They're different sciences, but you just want someone familiar, as well as feeling welcome and warm. You don't want to feel stressed out at your acupuncturist's office, because you're there to de-stress. I mean, that is an important component of getting an acupuncture session. So we lead very, very busy, stressful lives. And this is an opportunity to tell the body that you have the room and the space to conceive. And it's kind of like tricking your system into telling it that you are not stressed out, at least for that hour.
Yeah. I always left very zen, and I kind of like zone out, and it's like, was I asleep? Was I not asleep? I'm not really sure, like just kind of that daze. So
that's the sweet spot. You want to be in that in between, not quite asleep, not quite awake, but it's like awake dreaming. If you're in a good acupuncture session. It's very interesting, isn't it?
Absolutely. So can you talk to us about the benefits of acupuncture? Why acupuncture? How does it help? How does it help us with the challenges that we're facing with our fertility?
Yeah, there have been a lot of studies of why, trying to figure out why acupuncture can help. They do know that it can help with IVF and increase success. Without getting into the physiological reasons, there was a controlled study in 2002. It's the big study that most people have heard about. It's a German study where they took 160 participants. They split them into, one group got acupuncture for 25 minutes before their IVF, one group got acupuncture, and afterwards for 25 minutes. And then the control group just relaxed there for 25 minutes before and after. And there was a pretty significant increase in the success rate for those who got acupuncture. I think it was 42.5% compared to 26.3. It wasn't a double-blinded study though, but there have been some subsequent double-blinded studies, and what that means is that there would be a control group that thinks they're getting acupuncture but is not actually getting acupuncture. It's a really hard study to pull off, and sometimes they're even manipulating the acupuncture points a little bit while not getting needled. So it's really hard to do a double-blinded study. But there have been, and there was one in 2008, and it's published by the British Medical Journal, and that also showed an improved outcome for women who received acupuncture before and afterwards. The reasons why are still very mysterious, but they do know that there are a lot of physiological changes that occur during acupuncture. And one of them, it's very complicated, but the nitty-gritty part of it is that it reduces the sympathetic nervous system. It inhibits that. So when the sympathetic nervous system starts to slow and shut down, the parasympathetic starts, that's your rest and digest. Those hormones and levels start to increase. And by doing that, it improves blood flow to the uterus and all of the reproductive organs. It also helps to decrease your stress levels. It also produces natural opiates in the brain. It also increases lymphatic drainage. So there's a lot that's going on. It blocks pain receptors from, telling your brain that you're in pain. So that's why it works for pain as well. But yeah, and there's also a lot of mystery as to why it works too. They're not exactly sure 100%. So
of the science behind it.
Yeah.
And when you're going through a treatment, I remember when working with you that you would use different points and different techniques. Like we talked about the heat lamp before we started recording, depending on where I was in my cycle. As a patient, as a client and patient, we always talk about advocating for ourselves. How do we know? I know we need to trust our practitioner, but like, how do we know what to ask for or make sure that these different techniques are being performed at the right time in our cycle, so it's not hurting our cycle?
Right. I think that there are just a couple of basics that you would want to know. So, well, we talked about the heat lamp specifically. You don't want to change the core body temperature after an IVF transfer or after ovulation, because that can contribute towards a miscarriage. I mean, it's unlikely, but it can happen. They do recommend you don't go into a jacuzzi afterwards, or take a hot bath, or go into a steam or sauna. So you want to avoid a heat lamp after transfer or ovulation. But before that time, you want to increase blood flow there. So a heat lamp is wonderful to use during your menstrual cycle and pre-ovulation. And another thing is there are points that are used also pre-ovulation that are not used that I don't use post-ovulation, and because they're very moving in nature. So you want to make sure that your practitioner, honors that and doesn't use points that are, prohibited during pregnancy after ovulation. And if they're a decent acupuncturist, they know those points because, they're pretty much drilled into our heads. And so we honor, that's part of the practice, you honor those points.
And I think maybe, at the beginning you said it's really important to interview your acupuncturist. And I think I think that that's important too. Sometimes we're just like so desperate, like, wait, I just need an appointment. I just need to get in. But it is worth it to have that conversation or that consultation just to make sure that you and your acupuncturist are vibing, right? There's a relationship and a rapport that needs to be established, but also to make sure that you feel comfortable in what your practitioner is sharing with you in terms of treatment.
Yeah, and another clue is your practitioner should ask you where you are in your cycle every time you see them. We like to divide the menstrual cycle into 4 stages. So, and a lot of it has to do with the energetics of that cycle. And we divide those energetics into yin and yang energy. Yin being and you can go deep. You could write a book on yin and yang, but yin energy is cooling, it's nurturing, it's nighttime energy. Yang energy is sunshine, it's moving energy. And so where you are in the 4 stages of your cycle would be pre-ovulation, ovulation, post-ovulation, and your cycle. And those correspond to different yin-yang phases. So where you are is what we nurture. And if we see any problems in that phase, we try to balance them with either, acupuncture points or herbs or both. So the practitioner should be definitely very curious about where you are in your cycle. They could encourage you to, do basal body temperatures. They'll want to be very, interested in, what kind of treatments you're getting at your reproductive center. They should just ask those kind of common questions. That'll kind of clue you into what they know.
You just brought up herbs and supplements, and that was going to be my next question. So I know not every practitioner is, I guess, certified. You said you need to be certified, right?
In New Jersey, you do. Some states you don't have to. You could practice herbs without having gotten a degree in herbs. But in New Jersey, it's interesting. You can go to Whole Foods and they can sell you herbs. But if you go to an acupuncturist, they have to have had a master's degree in herbology to be able to prescribe you herbs, which I think is fair,
Okay. So, yeah. I want to have a disclaimer here. Please don't ever start any sort of supplements or herbs without talking to your doctor, your practitioners. But can you just share with us what are some of the common ones that you see used within the fertility community?
I think it's a great question. In Chinese medicine, herbs are not used singly. They're used in the context of a formula, and they really depend on the nature of the problem that we see with the patient. So, if we see a patient who, let's say, has PCOS, we call someone with PCOS as a waterlogged type. We would use more drying type herbs. We would supplement the spleen energy. And by spleen, I don't mean the literal organ spleen. I would mean the energetic organ. So it would really be in the context of where you are in your cycle and what kind of issue we're seeing with that cycle.
So really it's individualized. There's not just like a blanket.
Individualized.
Because so often we hear
it's not a one supplement fits all or one herb fits all. I know I've had patients come and they all want to take Vitex and that's fine, but that doesn't always help if you have a different kind of problem,
So really, this is the other benefit of working with a practitioner that knows about these things, because you just said it's 2 things. It's about really where you are in your cycle and what your body type is. And so it really truly is very personal.
Absolutely. Yeah.
That's so interesting.
And same with supplements. And the other thing is you want to really coordinate this with your physician, who's, if you're going through ART, they, I understand they want to control everything. And so they really need to be part of, like, I know you can't do sneaky herbs, when you're getting IVF, you really want to have them, know and get their approval too. They may not want you on herbs. They may want to just control everything with medication. And I have to honor that. Sometimes supplements, but even supplements.
that brings up the question for me is that's typically during a cycle. So some people, they're like, I'm taking a break right now. We're going to wait, especially right now. Like right now, as we're talking, it's the week before Thanksgiving. So like holidays are coming up.
Yeah.
So right now, you know, a lot of people are like, we're taking a break. Some clinics even close the month of December for like that deep clean. So people are thinking like January, the new year, February. I know that's not a lot of time. And I know acupuncture, it takes time. It's not like you go once and you come out and yay, right? It's
Right.
you have to be continuous with it. But I guess my question is, are there some things that we could do while we're in those waiting periods before a treatment starts to kind of get our body ready to enter a treatment?
I think so. I think you could, you know, try to make yourself as, you know, healthy as possible. And by that, I mean, you know, eat well. This is a time to really take care of your body. You want it to be a place where something wants to grow. So, you know, during the holidays, it's really hard not to eat the carbs and sugar. But if you can use this time to really nurture your body, to keep your body moving, to keep it well hydrated, to rest, to really try to limit alcohol and, you know, a cup of coffee, of course, but lots and lots of coffee a day, maybe not so much, and to try to de-stress. And, you know, I know that a lot of us are addicted to, you know, TV shows, the adrenaline pumping, you know, and the news shows. But if you could watch comedies and things that are not going to like increase your cortisol levels, that would be a good thing. Try to like keep yourself calm. Try to avoid toxins in your home and perfumes, and try to eat organic. It's a lot, but they all add up. They really do. They add up.
They do. And we oftentimes, when we talk about toxins in our environment and organic and our clean water, like I have a whole water filter and we just redid our whole water filtration system. But it's a lot. But the trick that we kind of go by is you just buy better next time. So it doesn't mean, especially with beauty products, you don't just like throw out like everything that you have. Just the next time you buy better. And I always tell people just start with deodorant. That's like the easiest one. Just the next time, just
and
buy
don't use
differently.
Febreze. No Febreze.
No Febreze. No Febreze. Next time you buy laundry detergent, buy better. Right.
Right.
Next time you need Tupperware, get rid of the plastic and
get the glass.
Right. Get the glass. Get the glass.
Because that way you can do it in a non-stressful way, because we're also trying to reduce our stress.
Yes, there's a lot of things that we're trying to do, right?
Yeah, and I like that now you could find a lot of mindfulness apps that are targeted for women who are trying to conceive. And I love that, because a lot of them will come for a treatment and they will listen to that meditation session, and some of them are geared towards where you are in your cycle. And I think it's just, you know, in Chinese medicine, there's a saying, where the mind goes, the qi goes. So I really like that. And I think that, you know, mindfulness is really important, and, you know, thinking positively. And I'm glad that there are some nice apps that are available for women now.
Yeah, there are. I never thought to pair meditation with it, but that just makes perfect sense.
Yeah. Yeah. Because it's a very suggestible state. When you're in acupuncture, it's almost like you're hypnotized. So that in-between state is almost like hypnosis. So you tell yourself positive thoughts, positive outcomes, and it works even better, you know.
Just in talking with you, it just makes me think about how working with a practitioner is so much more than just that hour that you get, you know, while you're in that kind of daydreamy state. It's really about helping support you with this healthier lifestyle to get not just your body, but your mind, your spirit, to get everything kind of ready and prepared for the journey, right? For conceiving, for becoming a mother, for entering into parenthood.
Yes, it takes a village. You know, I think I mean, nobody cares more about your fertility than you and your spouse, but it does help so much to have a supportive network around you, whether it be like support groups like Kindred Beginnings, or you know, a practitioner, an acupuncturist, massage therapist, your IVF team.
All of the above.
Mm-hmm.
Do you have anything that you'd like to share with the community?
Well, you know what? I brought a box of needles, so I could just show you if you, yeah.
I brought a box of needles. Yes.
Yeah, I mean, I thought right before, I'm like, oh, that might be interesting to show you, because I know it's nerve-wracking for a lot of women. I mean, women going through ART often are poked and prodded so much, and that is stressful. And I know that it sounds like an added stress to get, needled with acupuncture needles, but they're very small, and I wouldn't say that it's completely, that you don't feel anything. You do feel sensation at some of the needles. Some of the needles you don't, which is interesting. And sometimes the practitioner does want you to feel some sensation that we call the chi at the needle site, but it shouldn't be sharp or burning. It should be quick and achy. And then when the practitioner stops, manipulating the needle, you shouldn't feel anything at all unless you move.
I remember there were some times like you would get me in certain places and it would be like a release.
Yes.
Is that what you're talking about? The chi?
That's the chi.
Like
that's one way of, that's one type of sensation at the needle, but there is a release. That's a point. I know that's a point.
It was always right. It was always right there. Yeah.
So you can see here's a needle, and it has a guide tube around it, and that is used. It helps to like create a sensation around where the needle will be stuck, so that it's less, you feel less sensation when the needle is going in. So you're feeling the guide tube pressing against your skin and not the needle, if that makes sense.
Mm-hmm.
So yeah, here, I'll use that point. So you press the guide tube here, and then the needle just gets tapped in like that. And then it gets inserted a little bit after that, after it's tapped in. And it doesn't hurt. I mean, it's sometimes achy.
I think what freaks most people out is like, then the needles just stay in you for such a long time, but truly like, that they're there, but they're not like a nuisance. They don't really bother you.
Right. They only bother you if you move around. But then there are some people, I mean, I've had people get off the table and answer phones with needles in. So there are people have different thresholds of sensation. Some are very sensitive. I happen to be sensitive to needles. But then there are some that don't feel anything at all. It's amazing, the range. So
yeah, for sure. So Rachel has a bell. So if you need her, you just like ring the bell.
I do.
Then she comes.
I think it's important because if you get panicky on the table, claustrophobic, which rarely ever happens, but my mother had that experience before I was an acupuncturist. And I remember her telling me the story that she screamed her first treatment because she didn't know how long she was going to be on the table. The practitioner never told her. And she just got panicky and she started screaming, so after that I thought, she could have used a bell.
Yeah, she could have used a bell. And see?
The bell. Yeah.
It's brilliant. Any last tips or anything for us?
Any last tips?
Yeah, what are your last words to leave us with? Because you talked so much about, how acupuncture helps with our body, with our mind, how we do need to have different kinds of treatments depending on where we are on our cycle, to interview our acupuncturist to make sure that he or she is familiar with the woman's body and cycle, and almost like cycle syncing too, really is what you're speaking to. Yeah. So what are some like last minute tips, like one big takeaway you want our friends to hold on to?
This is a tough one, but I will just say to be mindful within the journey. I think that that's the most important thing, because it could be so regimented and mechanical, and what it is about for many women and couples trying to conceive, it can become so mechanical that it could be so stressful to the relationship. So be mindful in the journey. Don't forget, who you are as a couple and
who you are as a person.
who you are as a person. That's right.
It can totally suffocate you.
It can be so difficult at times. So
Rachel, thank you so much. We're going to stop the recording so we can do a Q&A, but thank you so much for your time.
oh, my pleasure.
If anybody would like to reach out to you, tell us how we can find you, especially for local. Yes.
So if you were to call me, it says I'm not accepting new patients, but if you are a member of Kindred Beginnings, please let me know that. I am booked out a couple months ahead. So if you have an IVF cycle coming up, and I might not be able to help you with that. But if you were looking long-term and wanted to try to get to see me, I will try to accommodate you really as best as I can. And I can make recommendations for you, so you can get seen sooner. Okay.
Thank you so much. We appreciate
You're welcome.
that. Thank you, Rachel.
My pleasure. All right. Good to see you. And thank you for inviting me today. I appreciate it.
Oh my goodness. You're so welcome.